everyone, today we'll discuss about the whole root, the segments and the branches of the facial nerve, and I'm sure that at the end of this video you'll be easily able to memorize the each and every step through which the facial nerve passes and about the various segments of the facial nerve as well. So this is the whole diagram of the various roots of the facial nerve, so we'll understand it in a bit easier manner. So through all these steps the particular facial nerve passes. So we'll discuss about each and everything step by step. So first of all, the facial nerve originates from the pons, particularly from the cerebellopontine angle. So this facial nerve originates from the pons, then it makes a U-turn or it bends around the sixth cranial nerve, and this bend is known as what? It is known as the facial colliculus, right? Now this particular nerve goes ahead. Now this is the motor part of the facial nerve. There is also a sensory part of the facial nerve, that is the nervus intermedius of the Wisberg. Now this both sensory and the motor part goes ahead and together they passes through the internal acoustic meatus, right? Now I will tell you all the segments of the facial nerve when the particular segment comes. So over here we have two segments of the facial nerve. That is, first of all, from the pons up to the internal acoustic meatus, there is the intracranial segment of the facial nerve. Simple. And when it passes through the meatus, simply the name is what? Meatal segment. Very easy. Now this facial nerve goes ahead and it approaches the medial wall of the middle ear. It approaches the medial wall of the middle ear, and over here what happens is it relays its fibers through the geniculate ganglion, and what happens it makes a bend, and the further nerve passes horizontally. Okay, so two things over here. It passes from the internal acoustic meatus and then it relays its fibers to the geniculate ganglion, and then it makes a bend and runs horizontally. So over here also we have two segments of the facial nerve, that is from the end of the meatus up to the geniculate ganglion. This segment is known as the labyrinthine segment. Okay, and this horizontal nerve over here, as the name says horizontal, so its name is horizontal segment or the tympanic segment of the facial nerve. Simple. Now let's make our nerve move ahead. Now this nerve will go downward, will go ahead and gives a branch, that is the stapedial nerve branch. Now it again goes ahead and enters or passes through the stylomastoid foramen. So again we have a segment over here from the end of the horizontal segment up to the stylomastoid foramen. This segment is known as the mastoid segment. Mastoid segment. Okay. Now after it passes through the mastoid segment, it goes ahead and gives two branches, that is the stylohyoid, the nerve to stylohyoid, and nerve to posterior belly of digastric. Simple. And then what happens is this nerve passes through the parotid gland, but it don't supply the parotid gland. Very importantly, it passes through the parotid gland but don't supply the parotid gland, and from there it gives, very importantly, 5 branches. 3 zebra, bit my cat, temporal, zygomatic, buccal, marginal, cervical branch. Remember the mnemonics: 3 zebra, bit my cat. These are the important 5 branches of the facial nerve. Now this facial nerve over from here, it gives a branch, that is the chorda tympani branch of facial nerve. Now this branch goes ahead and relays its fibers onto the submandibular ganglion, and then it supplies two important glands, that is the submandibular gland and the sublingual gland. Now this chorda tympani nerves gives the taste sensation to the anterior two-third of the tongue, and then it gives the parasympathetic branches to the submandibular gland and the sublingual gland. Okay. Now one more important fact is that if you have seen my trigeminal nerve root video, in that we discussed about the lingual nerve. Lingual nerve is a mandibular branch of trigeminal nerve. Now this mandibular branch of trigeminal nerve relays its fibers to the submandibular ganglion, and then lingual nerve over here, lingual nerve is a mandibular branch of trigeminal nerve, right? Now this lingual nerve also supplies the anterior 2/3 of the tongue, but that nerve supply is the sensory nerve supply of the anterior 2/3 of the tongue. So the taste sensation of the anterior 2/3 of the tongue is done by the chorda tympani branch of facial nerve, while the sensory part is supplied by the lingual branch of trigeminal or the fifth cranial nerve. Just remember this point. So this lingual branch is a branch of what? Mandibular branch of trigeminal nerve. So if you want that video, just after this, just watch that video to understand the whole fibers of the trigeminal nerve. Okay. So now this chorda tympani nerve supplies the taste sensation to the anterior 2/3 of the tongue, and then it gives two parasympathetic fibers which supplies the submandibular gland and the sublingual gland. Now come to this part. Now what happens is, we previously discussed that this particular nerve relays onto the geniculate ganglion. Now from this, a branch of the facial nerve passes, that is the greater petrosal nerve. Now this greater petrosal nerve is the parasympathetic branch of the facial nerve. It is a parasympathetic branch. Now before we make our facial nerve enter inside the pterygoid canal, one more important stuff that you should know is that over here, as you can see, this is the internal carotid artery. Now a nerve, that is a deep petrosal nerve, it loops around this internal carotid artery. Now what is this deep petrosal nerve? It is a sympathetic nerve. It is a branch of the carotid plexus. Now this nerve enters into the pterygoid canal along with the greater petrosal nerve. So this is what? This is the parasympathetic nerve, and this is the sympathetic nerve. Now these both nerve together, this greater petrosal nerve and the deep petrosal nerve together forms what? It forms the median nerve. These both nerve together forms the median nerve, and they both then goes downward and relays onto the pterygopalatine ganglion, and then gives orbital, nasal, pharyngeal and the palatine branches. So this was the whole root of the facial nerve. And of course, whatever part which is outside the cranium, that is the extracranial part, right? So till now, how many parts we discussed? The intracranial part, meatal part, labyrinthine part, horizontal part or the tympanic part, mastoid part and the extracranial parts of the segments of the facial nerve. Now some injury to the facial nerve. What happens when the facial nerve particular part gets injured? So if the facial nerve gets injured at the stylomastoid foramen, this will lead to facial palsy. If it gets injured above the chorda tympani nerve, facial nerve along with the loss of taste at the anterior 2/3 of the tongue occurs. Above stapedius, facial palsy, loss of taste and hyperacusis. Above the genu, this will lead to facial palsy, loss of taste, hyperacusis and even loss of lacrimation. So this was all about the facial nerve. I hope you found this video helpful. Thank you so much.